Hello everyone. Thank you for joining us on Candid Chats on Cancer. I'm Mary Robinson.
I'm Jamie Moore.
And we have a special guest today, and we're honored to have Dr. Timothy Hike with us from Nebraska Cancer Specialist.
Welcome, Dr. Hike.
Thank you very much for asking me to be here. I appreciate it.
You're very welcome. One of the things that we want to talk about is you probably could have been anything you wanted to be when you grew up. What made you choose being a physician?
That's a very good question. Well, I certainly couldn't have been anything. I probably couldn't have played Major League Baseball, which is what I aspired to do as a child. But my mother was in the healthcare industry. She was a nurse, and my exposure to her occupation and to her care and to what she did for her patients was really the driving force behind me pursuing medicine as a field. As my career and as my education moved forward, when you go through medical school, you have the opportunity to kind of choose your own path. And when I got through medical school, I didn't know what I wanted to do.
Yeah.
I still wasn't sure what my path was. And when that happens, sometimes you pick the broadest category of medicine, and for me that was internal medicine, where you take care of kind of the whole individual. So I did a residency in that, and during that experience I learned that I like taking care of sick patients. I like taking care of patients who, not that all patients don't have some degree of need, but the cancer patient has a more specific need that fit what I was good at. And that was the thing and the experience that really drove me into oncology and into trying to help people who have a diagnosis of cancer. I love what I do.
Yeah.
Well, I know that firsthand because you were my doctor when I was diagnosed in 2014 with acute myeloid leukemia, and I'm telling you, this man is amazing.
Yeah. And I'll let everybody know he was my physician too. He still is my physician, and he's one of the greatest people in the world.
Yes.
I think a lot about him. One of the things that we've been talking about with diagnosis is, getting a second opinion.
Sure.
Whether or not, if you don't feel comfortable with your physician, should you get another one? For me, Mary had already gone through the cancer, and then I had met you, and I called her up and said, I'm not quite sure about Dr. Hike. I'm not sure he's quite the fit for me. And who's your doctor? Because she'd always gone on and on and on about how great of a physician she had for her oncologist. And so I
immediately texted back,
yeah.
And I said, Dr. Hike is the most amazing doctor ever. You're going to love him. And because I think you had, was this the second opinion at this point or whatnot?
Yeah, that was my.
And I said I would never switch.
Yeah.
And he didn't. And look who's here today.
Yeah, because of it all. It was really a kind of a remarkable thing. It was word of mouth.
It is.
It's kind of, the good physicians in town sometimes are almost hidden. Is there anything that you guys are doing to try to get yourself more out into the public so that the public can know? Like, for Mary and I mean, we can gush all we want about you and we tell all of our friends, but that's a handful of people. Is there something that the Nebraska Cancer Specialists are doing?
Well, first of all, thank you.
You're very welcome.
Those
Thank
words those words mean a lot, and let me take those comments kind of in a twofold kind of view. First of all, anytime I meet a new cancer patient, somebody with a new diagnosis, you have to put yourself in their shoes. Mary, if you don't mind, I'll use your story as an example.
Yes.
The first time I met you, you are a self-driven woman who lights up any room that you walk into, and you were struggling because you couldn't do simple things, and you thought it was just because you were being lazy. You weren't exercising enough. You weren't pushing yourself hard enough, and I took one look at you and said, this person has a bad diagnosis. We didn't know what that was. And when you go through that experience and you're meeting somebody for the first time and they're sharing almost traumatic or catastrophic might be too strong of a word, but not too far from it. You want to have somebody who can understand that fear and can understand how scary something like that is, while at the same time being able to know what to do about it.
Exactly.
And that's called empathy.
Right.
And empathy is not something you're born with. It's a learned trait. It's something you get by practicing. And that's why it's called the practice of medicine. And anytime I see a patient for the first time, and we're working our way through that process of trying to manage the anxiety and the fear that a patient has, while also making sure that the correct things are done to achieve the diagnosis and hopefully optimize a treatment plan. As you're going through that, one of the first things I talk to patients about is getting a second opinion.
Right.
And I think I deal in a field of medicine that is stressful,
Yes.
that is scary, and it's anxiety provoking. And I always encourage my patients to get a second opinion. When they see me for the first time, there's kind of a litany of things I discuss with them. I talk about resources that I want them to use. I talk about my team, who we have in place to help them fight this process. And then I talk to them about, hey, not everybody likes everybody, and this is scary. And if you want to seek a second opinion, I fully support that. In fact, sometimes I encourage it.
Right.
Because in the end, I just want what's best for the patient. And I want that patient to be comfortable with their choices. And there's a lot of value in hearing something twice.
Yeah.
So sometimes people hear a second opinion and they think they're going to offend me when they ask about that. And that's not the case. Second opinions should be encouraged. The second part of your question in regards to what are we doing in terms of making sure that people know us as Nebraska cancer specialists and what we do. First of all, we take good care of our patients.
That you do.
Okay?
Yes, you do.
And we try to not just treat the patient, but to treat the whole person,
Right.
and to a sense, sometimes the whole family or the whole social circle. And we do that well, and because we do that, word of mouth is the primary driver behind the reason that we're able to practice medicine the way it should be.
Yeah.
We have a large component of our practice is community outreach, doing things like this. A large component of our practice is helping to support certain fundraisers that are cancer specific. A large portion of our practice is focused on the mental well-being of patients. A large portion of our practice is research, because you've got to try to move that dial to continue to make improvements in the treatment of what can be a devastating disease.
Yes.
And I do want to point out, too, that I would have stuck with you, Dr. Hike, for the second diagnosis of my acute myeloid leukemia coming back, but I needed a stem cell transplant. And I believe at your practice you don't do those, is that correct?
That's correct. So there's.
And so he actually referred me on.
That's correct, and that speaks to the strength of the medical community in Omaha.
Right.
You know, when I saw Mary for what was to be a routine visit, I saw something in her blood counts that I didn't like, and as Mary and I usually do, we're poking fun at each other and talking about each other's kids. And I took a look at the blood counts when they came up, and I said, we need to do a bone marrow biopsy. We need to assess to see if there's any evidence of residual leukemia, recurrent leukemia. And there was. And when that happens in somebody who's as young and as healthy as Mary is, the treatment of choice is what's called an allogeneic stem cell transplant.
Right.
And a place like Nebraska Medicine, they can do that because it requires a tertiary academic care center to get something like that done. Nebraska Cancer Specialists has transplant capabilities in terms of autologous stem cell transplants, and we do a large portion of those through the Methodist and the CHI Bergen hospitals.
Can you refamiliarize us with the autologous
Sure.
stem cell is?
Sure. So there's an autologous stem cell transplant and an allogeneic stem cell transplant. Autologous means that they collect the patient's cells, and typically they treat with some form of chemotherapy to eradicate any residual disease, and then they reinfuse those same cells to rescue the bone marrow. Okay. So autologous means auto means self. And that's why it's referred to as an autologous stem cell transplant, as opposed to an allogeneic transplant, which is where you try to find the most ideal match of somebody else, but not yourself.
Right.
Okay. And in Mary's situation with recurrent leukemia, very clearly the treatment of choice was an allogeneic transplant,
Yes.
stem cell transplant, and we're lucky to be able to have a facility like that in Omaha at Nebraska Medicine that can take care of patients like that.
Yeah.
And the transition between my care, our care through Nebraska Cancer Specialists, and there was pretty seamless.
It was. And I think also I trusted you so much that I trusted your referral to my new doctor, and it just happened so fast. I mean, you know, they worked with me really fast, and I think that also really helps too when you trust your physician.
Sure.
And we had that rapport.
And that rapport is of utmost importance.
Yeah.
Because in the end, as I alluded to when we first started discussing, this is scary. And when I see a patient walk into my room for the first time with a diagnosis, you have to remember that fear and that anxiety, and you have to say, "God, if this was my sister,
Yeah.
or my wife, or my best friend, you know, what would I want them to know?"
Right.
And try to talk to them in a language that they can understand. Because if I sit here and babble a whole bunch of medical jargon and it goes over your head, you're going to leave more confused and more scared than when you came into my office.
Yeah.
And I've done nothing to benefit you then.
For a lot of people, even for myself, you know, once you hear cancer, it's kind of like everything, you know, the physician says, it's kind of like blah, 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 like the Lucy and the, you know, you hear cancer, then you hear what the diagnosis or what your outcome might be.
Statistics.
And this, well, I got to admit, with Dr. Hike, for me, he gave me better statistics than what I gave myself. He goes, you got a 50-50 chance. And I went, okay, well, I gave myself about a 20-80 chance. And so I figured, okay, I'm going to go with him.
Yeah.
I kind of like his
And I'm
odds
going to be
better
in the
than mine.
percentage that wins.
Yeah, and so at least it was a 50-50. And,
Yeah.
you know, one thing I really enjoyed about your office, and my experience was much different from hers because she was in the hospital. I chose to have my chemo at your clinic. And I don't know what to call it. I always call it a boutique chemotherapy place. Because you have about 12 or 14 chairs. The nurses are the greatest in the world. I just loved my nurses. Kathy and Tori were just, every day they treated me with pure kindness. I remember even towards the end of my treatment, my bladder control wasn't as good as what it should have been. And I wet my pants on the way to the bathroom. And when Kathy just didn't miss a step. Nurses are just amazing people. And I got to find that out from the opposite side of the fence.
Sure.
And I also got to find out, you know, we do live in a very beautiful community for cancer people here in Omaha. But when it came to the second opinion, you don't always need a second opinion of a physician. It was her second opinion that said, yeah, you know, this guy is the greatest. And I had been introduced to you through my GI surgeon who said, I really love this guy. This is the person who you need to stay with, you know. And it was just great. And I've had just a wonderful experience in your office from the minute you get there till the minute you leave. The girls at the front desk are always got a smile on their face. They're always accommodating. Seamless is, it's a beautiful term for it.
Yeah.
Well, again, that's very kind of you, and we work hard to try to make that happen, and we work hard to try to make sure that patients feel as comfortable in, again, what can be a scary situation.
Yeah.
one of the nice things about Nebraska Cancer Specialists is that we're community oncologists. You know, our focus is to try to optimize the care of the patient. And one of the ways that we do that is we have multiple locations throughout the city. We have, you know, a place in Papillion, which is where you see me, Jamie, and we have a place out in Fremont, and we have a place near the Lakeside Hospital, and one at Methodist, and then one at CHI Bergen. And those locations throughout town allow patients to have some sense of normalcy to what can be scary. When you recognize an area and you recognize, you know, the people in the building and their neighbors and friends, that's one of the beautiful things about the Omaha area is that exists still. And I tell people all the time, particularly when I'm down in Papillion, because it's a small, you know, doctor's building. It's not an enormous, you know, marble tower. But the level of care that comes out of that facility is second to none. And
I'll second that easily.
And I tell people all the time that they think they come to that facility to see somebody like me, you know, somebody with an MD down behind their name, but the nurses drive it. All right, and any patient who is taking chemotherapy will tell you that is you know, the nurses drive the care, and the nurses at Nebraska Cancer Specialists are second to none.
Yes.
They really are.
They always had a smile on their face. They you know, my stupid jokes, they laugh at it. You know, and it was just, they always just made you feel comfortable. I mean,
And when, oh, go ahead.
the whole process actually from start to end, it is nice. I didn't like the big hospital setting. I felt very uncomfortable in the hospital setting for that exact reason why you have a smaller one at Papillion is you didn't have the same nurses every time. And you know, one time you may have one staff, one time you may have another. Even when I came in for like to have injections, sometimes I'd have to go to Methodist just because it was closer to my office. But I always miss my nurses, you know?
Yep.
And still now when I go in, you know, it's kind of when Kathy's not there, it's like, hey, wait a minute, who gave her the day off?
Well, that's
so-
like me at Methodist. I was there quite often, you know, in the hospital, and all the staff was important to me, even the cleaning crew, everybody. And that was my home away from home when I was hospitalized. And I was fortunate enough to have you come visit so often. I think every day you saw me, unless you happened to have to go on vacation. But
Vacations?
yeah, vacations.
Where'd you go on vacation?
So, I mean, you know, I just highly recommend anybody from your facility. And I miss the nurses there. But it's so nice when I do ever visit to be able to just visit and be able to leave.
Of course,
Yeah.
of course.
Yeah.
You know, we have we call them company-wide meetings once a quarter, where everybody that forms the team that is Nebraska Cancer Specialists come, and every now and then I get asked to talk to people, you know, in the morning and before the hours of the work hours start, and I tell them that no matter what their job is, whether there's somebody greeting somebody at the door, or helping people with insurance questions, or helping to get a drug approved, or giving chemotherapy, or being a mid-level provider, the purpose of their job is to help patients.
Yeah.
And we're so lucky to be able to do that in today's, you know, day and age with the medical system being tough to navigate. We're good at that.
Yeah.
And I get to work with people who remind me of that every day.
Yeah, you have a really remarkable staff, just through and through. So cancer is very scary. All day long, you have to give good diagnosis, bad diagnosis. Sometimes you just even have to tell somebody they're stable. What do you do when you go home at night? I mean, how do you decompress from having to go through, 12, 13-hour days some days?
I don't know how I do this job sometimes. Certainly I have the things that I relax with. My wife and I have twin 10-year-old boys.
Oh, geez.
I coach them in soccer. I take them to and from Taekwondo and their music lessons along with my wife. And my family's my biggest source of decompression. And you just have to find that balance between the stress of your job or any job, and be able to have that time where you can just say, I'm going to worry about those things tomorrow.
Yeah.
And I try to encourage my patients to do the same thing. Control what you can control, and sometimes you have to accept things that you don't want to accept, but you have to.
You just smile through it, and you just.
And I do think attitude is everything, really. If you have a positive attitude, and faith also got me through it too, and a great doctor and a team of nurses, then you have everything.
I remember a story about you specifically, Mary, when you were just at the diagnosis, the first diagnosis, and we were just kind of formulating our initial treatment plan. You asked me about that. You asked me about, what attitude should I have, and I don't think you have the choice to have that. You kind of either are upbeat and optimistic or you're not. But I said that if given the choice, I would prefer you to have fight and optimism and hope. And I use the analogy, it's like standing at the bottom of a mountain. If you stand at the bottom of that mountain and you know you're not going to get to the top, you got less of a chance of achieving that goal than if you stand at the bottom of that mountain and say, I'm going to get to the top of that mountain. Your chances improve. And I try to give my patients that perspective when it's appropriate, and sometimes it's not appropriate. As too often happens in my field, sometimes people die of cancer. Right. And one of the ways that I wake up every morning to do this job is to know what I call a good death. I see patients all the time whose diagnosis has reached a point where perhaps something like palliative care or hospice may be their best option. And I talk very early on to my patients about that, introducing the notion of what that is, and making sure that you address that and answer questions, because patients don't know what a stage 4 diagnosis means. They don't necessarily understand that. Why would they? But sometimes the best thing I can do for patients is to give them some perspective,
Right.
Yeah.
and some guidance in terms of what this diagnosis means. And if the time ever comes where the cancer is winning and the battle should come to an end, I like to think that I've formed a relationship with the patient that's close enough, and one based on trust, that they'll trust me to help them achieve what I call a good death. Right. And I define a good death by one where your pain's controlled, you're surrounded by who you want to be surrounded by, and ideally you are where you want to be. And countless times I've had patients come back to me, patients' family members come back to me after their loved one had passed, and they thank me for that. Yeah. And that's as powerful as, sometimes as powerful as giving chemotherapy or recommending an allogeneic transplant, is making sure that you care for somebody like they're your family member. Yeah. And that's what I try to do every time I see a patient.
What would you recommend for patients? I know, like when my wife came in, I always had to have her with me because I would forget about probably 75% of whatever you told me that day. Yeah. What would you recommend to the support systems that come in with us? Should they come in with questions already written on a pad for you so that they can just hand it over, or what would you recommend?
So typically what I would recommend is come with a list of questions, but don't lead the physician. The physician should sit down with you and talk to you about the diagnosis, and talk to you about the prognosis, and talk to you about the potential treatment options. And if the doctor does a good job, oftentimes those questions get ticked off as the doctor's talking. and educating the patient. And oftentimes we see in the patient room, loved ones taking notes. I try to write everything down for them, just on the paper that covers the exam table. I sit down.
I remember that.
Yeah, I sit down and talk to them about that.
You know what, we got just a couple seconds. Is there anything that you'd like to say on the way out the door to everybody?
Thank you for the opportunity to have me here. I really appreciate it. I'll be happy to come back whenever, and it means a lot that you asked me to be here.
Well, it means a lot that you saved my life.
Yeah, it means a lot that
Thank you.
that both of us are here.
Yeah.
We can't be more proud than to have you with us and be with you.
Well, thank you. I think what you're doing is commendable, and I think being able to get this information out into the community is a valuable resource.
That
Thank
we
you.
plan on doing.
We plan on doing a lot more episodes.
Yes.
As long as
Good.
we have guests like you, right?
Well, I might come back.
Thank you. We really appreciate
You're
that.
always welcome back at any time. Yeah,
Thank
for
you,
sure.
Dr. Hike, for being with us.
Of
And
course.
if anybody needs any information, I'm sure they'll find it on our website.
Wonderful.
Okay.
Thank you.
Thanks, everybody. Join us next week.